Hi, I am Dr. Mamta, pediatrician and neonatologist at Cloud9 Hospital, Sarjapur Road, Bangalore. So, how can we prevent infections in preterm baby? So, why are we worried about infection, especially in a preterm baby? Is their immune system is underdeveloped and they are very prone for infections. That is why we also take so much precautions for babies inside the NICU. So when the babies are inside the NICU, all of us, including the doctors, the nurses, and even the parents entering the NICU, should wash hand strictly for at least 60 seconds, and we will be using a hand sanitizer before touching the baby. So the same practice should continue once the baby is discharged home. So before touching the baby, the parents should wash hands, and also before giving feeds to the baby, and maybe after you change the diapers, and especially if parents have touched the nose or mouth of their own self, they should be washing hands before touching the babies. The other few factors which will help to prevent infection in preterm baby is reduce the number of visitors that come home after the delivery. After the baby comes home, it's a joy for everybody. Everybody wants to come and see the baby when it comes home. But we should avoid visitors because the babies can catch an infection like a flu from any one of the visitors, which can be very harmful for the baby. And also, as parents, we do not advise them to take the baby out for any outings or any public places, especially during the winters where they can easily catch a flu. Then what about the vaccination for these extreme preterm babies? So the vaccination for extreme preterm babies is just as similar to any baby who is born after 37 weeks. The only thing is the hepatitis B vaccine, which we give at birth. For any baby who is less than 2 kgs, we will have to give an additional dose because the vaccine, the immunity that we provided from the vaccine may be slightly less when the baby is less than 2 kgs. Other than this, all the vaccines which are recommended to a baby should be given at the timely interval. If baby stays in NICU for a longer time, maybe these vaccines may get delayed a little, but they should be given at the earliest possible to prevent infections against all these deadly diseases. How do you recognize infection in a preterm baby? So one of the first signs of infection in a preterm baby is reduced activity. They will become dull and they refuse to take feeds. The other important sign will be any fever in a baby, or preterm babies also show sign of infection as hypothermia, means the body temperature drops drastically. So that also is a sign of infection. Sometimes if they have a pneumonia, babies also will have rapid breathing or fast breathing, difficulty in breathing, or they may stop breathing, which we call it as apnea. So these are the most common signs of infection that a preterm baby will have. Many times they may have also vomiting, tummy may become big, there will be distension. They may not pass stools at all with tummy distension. So that also may be a sign of infection.